In this short video, we will explore the contents of the CanWatch Technical Guidance Note on measuring women's empowerment in the global health sector. This practical resource has been created for all global health initiatives, particularly those that are part of Canada's 10-year commitment to global health and rights. Published originally in 2021, this note has been developed primarily for civil society organizations, Global Affairs Canada project team leaders, and all other stakeholders adhering to the Global Affairs Canada gender equality policies and results-based management methodology. It draws on a thorough review of scientific literature, current policy and practice, and the experience of dozens of technical experts in Canada and internationally. Women's empowerment plays a critical role in ensuring sustainable, positive impact on global health. At the same time, when measuring empowerment, it is essential to adopt a rights-based approach while acknowledging that instrumentalist benefits, such as improved health outcomes, also exist. This technical guidance note begins with a discussion of key definitions and concepts, including but not limited to autonomy, agency, power, and co-creation. It also touches briefly on resources for a feminist approach to monitoring and evaluation, although in-depth guidance is beyond the scope of this document. Here you will find examples of empowerment domains that correlate to global health and a discussion of intersectional considerations as well. Empowerment must be locally defined, and accordingly, measures for empowerment must differ by context and reflect the unique identities and realities of women and girls. This note offers guidance on developing women's empowerment measures, both qualitative and quantitative. For example, in performance measurement, single variables, as opposed to composite measures, are recommended for intermediate level outcomes to demonstrate a change in behavior or practice. Ultimate outcomes may use composite scales or indices, using multiple domains to measure a change in empowerment as a state of being. You will find examples of scales and indices that have been tested and validated to measure empowerment, which you may reference. This section concludes with a discussion of limitations and challenges. For example, while many validated tools and measures are great starting points, the very process of contextualizing indicators frequently affects their validation. The note reviews best practice in this area, as well as measurement across socio-ecological levels, including household, societal, institutional, etc., as well as issues of bias and general availability of empowerment data. In section 4, we get specific. The note outlines detailed steps in measuring women's empowerment across the project model. It begins with the role of the theory of change and what this should contain, and then goes on to explore measures at the ultimate, intermediate, and immediate outcome levels, as well as outputs. Throughout, example indicators are provided. Practical guidance on data collection methods, both qualitative and quantitative, frequency, and ethical issues are included. The importance of co-creation and participatory approaches, reducing oversampling, and creating space for identifying unintended project consequences is underscored throughout. The remainder of the note is focused on putting everything into practice. In section 5, you will see examples of Global Affairs Canada results chains for measuring empowerment in global health programs, which help the user to understand how their own results chain might be expected to look from the donor perspective. In section 6, we bring everything together in a short 2-page checklist, which can be printed and used as a project management tool. Finally, in section 7, you will find a full suite of resources, including published and gray literature, manuals, tools, relevant policy links, and more. These have been sorted into topical categories for quick reference. Measuring women's empowerment is complex. There remain gaps in our collective understanding and practice, which should be addressed in future iterations of this note or through additional guidance. For example, much of the available literature focuses on the empowerment of women and girls and may unintentionally exclude adolescents. As noted earlier, application of feminist approaches is touched on briefly, but requires more robust attention. Non-binary understandings of gender and the experiences of people of diverse gender identities is required. In addition, the various intersections between sexual and gender-based violence and empowerment measurement are not fully explored here. Recognizing the limitations of a brief technical note, we hope that it is a useful tool for global health and rights initiatives seeking to measure empowerment. CanWatch is grateful to Global Affairs Canada for supporting the development of this note, and to the dozens of Canadian and global experts who lent their time and expertise to its review. To download the note, please visit our website at canwatch.ca/empowerment guide. This document is intended to be an evergreen resource. We therefore welcome and encourage you to share additional resources or insights which can be included in subsequent revisions of this note or in separate sector resources. Please share these with us by email at impact@canwatch.ca.